Real quick, I just wanted to bring attention to a story that's got a lot of controversy surrounding it. I'm not going to put my own personal spin on it, but I thought you guys should know about it, and I'll include links to the story in the sidebar down in the movie or in the video information. The story has to do with a woman named Afi Siddiqui. She's a woman who was recently convicted in Israel of opening fire on soldiers. And there's a lot of controversy around her because she's been missing for 5 years up until now, and her kids are still missing, which is kind of a scary thing. Like, maybe she did some bad things, but why are her kids still missing, or whatever. I don't know. I don't want to put my own spin on the story, but you guys should check out the story, and I just wanted to bring some attention to it. Now I want to continue with my topic from last week about healthcare reform, and I want to talk about why it's such a minefield. Essentially, healthcare does not function properly in a free market system. It doesn't really follow the supply and demand model. In a free market system, you have producers who sell their goods for money, and you have consumers who buy their goods for money. And you might say, well, that's like healthcare. You have doctors and drug companies who sell goods to make people better, and you have sick people who buy those goods to get better. But that's not exactly true. In our healthcare system, we have a middleman called the insurance company, and they have the opposite goal. They actually want to sell you something, but never you actually get what you're paying for. That's how they make their money. It's sort of the opposite of supply and demand. You're paying for the service, but you hope you never have to use it. So you have two competing ideas on the producer side. You have the doctors and drug companies who want to sell you their goods, and you have the insurer who doesn't want you to get those goods. On the demand side, you have two conflicting parties as well. You have the sick people who want to pay as little as possible to get the goods to make them better, and then you have the insurer who wants you to pay for the goods but never actually get them. Not to mention the fact that the drug companies and doctors don't actually want to cure their patients. They actually want to treat their patients, because what makes them more money? A patient who they cure with one visit, or a patient who they have to treat every week for the rest of their life? And then you have the same problem with the insurance companies. They have the mentality of, it's not broke, don't fix it, where preventative care is actually much more cost-effective as a healthcare system than treatment and curing people. Then the icing on the cake is you have over 45 million Americans uninsured, and who do you think is paying for that? A lot of them get paid through Medicare and Medicaid, which is out of the pockets of the taxpayers anyways. Don't be an idiot. The healthcare reform program needs to be done. There is no right or wrong answer, but healthcare is a political minefield. You've got insurance companies who want you to pay for coverage but not actually use it. You have doctors and drug companies who want to treat but not cure you. You have people who are sick who need coverage they can't get, and you have healthy people who don't need the coverage that they're paying for. The United States spends more on healthcare per GDP than any other country in the world. And hell, we don't even have the best healthcare. We don't even have close to the best healthcare. According to the World Health Organization, the United States healthcare is ranked 37th. 37th. You know where that puts us? That puts us in the Slovenia healthcare range. Slovenia? Didn't quite think that's where our healthcare stood. Where does all that money go? The United States spends an exorbitant amount of money on healthcare, and you compare us to the other G6 countries, the UK, France, Japan, Germany. We're the worst, the last, the least good. We have a half of a year life expectancy shorter, and we have the highest infant mortality death rate. What the... My economic tip for the week is don't be an idiot. There was another earthquake in Chile this week, and there's going to be more charitable donations and organizations springing up to help the people of the earthquake. Please use a responsible, recognized, known, trusted organization. Don't just search on Google and go, no, charity disaster, and donate a bunch of money and then find out later you got scammed. It's better to be caring and don't donate than to be caring and stupid and give money away to some con artist. Don't be an idiot. Alright, interwebs, that's all for today, but follow me on Twitter, links to the stories I talked about, rate, comment, and subscribe!